But we didn't finish the other thing.
Yeah, first we'll finish last few slides, couple of slides of axial skeleton. Then we'll start the joint. You know that your vertebral column or spine, this is the vertebral column, right?
Yeah.
It keeps the body erected and straight. Now, there are few clinical conditions or abnormal conditions where the vertebral column is bent, not straight. What are those conditions? Scoliosis, kyphosis, and lordosis. So those three are abnormal bending of your vertebral column or spine. So first we'll see those three, and then we'll talk about another clinical condition related to the vertebral column, that is called spina bifida or bifida. So here you see scoliosis, kyphosis, and lordosis. If the vertebral column is bent sideways like this, scoliosis, yes. So that is scoliosis. And if you see the vertebral column, usually this happens in upper part of the vertebral column, in thoracic area. In this area of vertebral column, it happens more, is curved. Upper part of the body is curved forward. So the vertebral column is like this in thoracic part. So what happens, you see, the upper portion of the body is like this, and that is called kyphosis. Anybody remember Hunchback of Notre Dame, the cartoon you watched, I believe, everybody. So Hunchback.
We should watch it.
That's a nice one. I like it. So that is kyphosis. And lordosis is usually it occurs in the lower part of the vertebral column in this area. What happens? The lower part of vertebral column is pushed forward like this. If somebody pushes you from the back like this, okay, so that is the lordosis. So scoliosis like this, kyphosis, and lordosis. So those are three conditions, abnormal conditions related to the vertebral column abnormal bending. Now another clinical condition, that is called spina bifida or spina bifida. What is that? You see here, these are the spinous processes of vertebrae, right? You already know spinous process in the back. When a vertebrae is formed, during the formation of a vertebrae, the bone forms from 2 points, 2 centers. So from 2 points the bone vertebrae is formed, and 2 halves join together to form the vertebrae. For any reason, if the fusion of 2 halves doesn't occur, so what will happen? A space will remain in the back. So 2 halves will not fuse correctly, so a space will remain there. And through that space, inside the vertebral column, you have the spinal cord, and its covering is called the meninges. So sometimes only meninges can come out through this space. Sometimes both the covering meninges as well as the spinal cord, part of the spinal cord, can come out through the back. And if you see you see the first picture, the covering meninges as well as the spinal cord came out, and this condition is called meningomyelocele. Okay, meningomyelocele. And if only the covering comes out, that is called meningocele. So two different conditions. The first one is more dangerous because you see the spinal cord also comes out. Sometimes paralysis. The person may suffer from paralysis because of the damage of that. Okay, so those are two conditions due to. So both are related to the genes come from the parents, genetic disorder. Mostly responsible, genes are responsible for that. Okay, so now we'll talk about a new topic, that's the joints. Joints are also called articulations. So, joints or articulations are the locations where two or more bones unite or meet or articulate. So, joints are the locations in the skeleton where two or more bones meet or unite or articulate. Okay. So here you see, this is the elbow joint. You all know that. How many bones are here? 3, right? The lower end of humerus, upper ends of radius, and ulna. So 3 bones form this joint. This is shoulder joint. 2 bones, scapula and the humerus. So 2 or more bones unite to form a joint. First we see how we classify the joints. Then we'll talk about the most common type joint in your body or skeleton, that is called the synovial joint. So we'll talk about a synovial joint, and then we'll talk about different types of movement occur in the joints. Joints are designed for the movement, right, of body parts. So we'll talk about different types of movements occur in the joints. So we classify the joints in 2 ways. One is structural classification, another is functional classification. So functional classification. So first, joints. We classify the joints in 2 ways: functional and structural. Okay. Functional classification is based on the amount of movement, how much movement occurs in that joint. We divide the joints into 3 types: synarthrosis, amphiarthrosis, and diarthrosis. Remember SAD, S-A-D. Okay. So synarthrosis, amphiarthrosis, and diarthrosis. When we say SES, that means plural. If I say SIS, synarthrosis, that means I am indicating only one joint. Okay, so singular and plural. Anyway, so those are functional types. Synarthrosis are immovable joints. No movement occurs. Amphiarthrosis, slightly movable. Small amount of movement occurs. And diarthrosis are freely movable joints. Plenty of movement occurs in diarthrosis. Let me give you an example. You know the sutures where the cranial bones unite, right? Sutures, and these are immovable joints because no movement occurs. That means synarthrosis, sutures. Amphiarthrosis, slight movement occurs. For example, when you breathe, you know that ribs move, but not a lot. Slight movement of the ribs occur, right? So, amphiarthrosis. Diarthrosis, plenty of movement. Example, your shoulder joint, you know, you can move a lot, right? In many different directions. So, this is an example of diarthrosis. So, that is functional classification. Then, structural classification. Structural classification is based on the structure in the joint. We divide into two types, fibrous and cartilaginous. Now, fibrous, its name is telling you that fibrous connective tissue hold the bones together. That's why this is fibrous. Cartilaginous, why? Because cartilages hold the bones together. So, in fibrous, fibrous connective tissue, and in cartilaginous, cartilages hold the bones together. There is another type that is called synovial, most common type. Okay. So those are three types of structural classification. Fibers, each has different types, subtypes. Fibers, there are three types of fibers. Sutures, syndesmosis, and another is gomphosis. Okay. So these are three types of fibers: sutures, syndesmosis, and gomphosis. Cartilaginous, two types. What are those? Synchondrosis and symphysis. Synchondrosis and symphysis. Those are two types of cartilaginous. So, three types of fibers: sutures, syndesmosis, gomphosis. Two types of cartilaginous: synchondrosis and symphysis. And synovial, there are 7 different types. We are not going to talk about all types of synovial. Just know that most common type of joint in the skeleton is synovial, and there are 7 different types of synovial joints. So that is the classification of the joints. Now let's see the examples. Okay, you see here fibers, bones joined by dense fibrous connective tissue. That's why it is called fibers. no joint cavity. There is no cavity in the joint. Usually synarthrotic, that means functionally usually immovable. Three types: sutures, syndesmosis and kyphosis. So let's see the example of these three. First, sutures. You already know that skull bones are connected by the sutures. So these are the sutural joints. You see, in sutures or sutural joints, their bones have borders like this. So this is one bone and another bone also has like this. So interlock like this. This is the border of one bone, this is another. What happens? They just go like this. And short connective tissue fibers connect the bones together. So here the space is filled by very small short connective tissue. So you see there the sutural joint. Syndesmosis. In syndesmosis, ligaments hold the bones together. So you will find in the joint ligaments are holding the bones together. So that is syndesmosis. You see the example is lower end of tibia and fibula. That means distal tibiofibular joint. Here, lower end of tibia and lower end of fibula are attached by ligament here. So that is an syndesmosis. Kyphosis. Only kyphosis is only present in the maxilla and mandible, where the teeth articulate with these two bones, upper and lower jaw. So, you know, in the mandible and maxilla, you have sockets, and the bone goes, the tooth goes inside that socket. So, you see here in the picture, socket of alveolar process, where the teeth fit in, and that is the kyphosis type joint. As I have mentioned, SIS is only one. If I say SES, that means more than one. So those are three types of fibers. I am repeating again. Sutures, cranial or skull bones are connected by sutures, and very short, dense connective tissue fibers hold the bones together. Syndesmosis, ligament holds the bone together. Kyphosis, teeth articulate with the jaw bones. Where one thing, remember, there is a ligament there that is called periodontal ligament. So, tooth is attached to the bony socket by that ligament called the periodontal ligament. Okay, so those are three types of fibers. Now we'll see cartilaginous, two types: synchondrosis and symphysis. Very simple. If the bones are attached by hyaline cartilage, that is synchondrosis. If the bones are attached by fibrocartilage, that is symphysis. So very simple. Example, you see here, this is the first rib, right? And you see here the rib is attached to the sternum by hyaline cartilage. All these are hyaline cartilage. So this is synchondrosis. But here one thing is know that only this one is synchondrosis, cartilaginous, but all these belong to synovial. We are not talking about this. This is a synchondrosis. Although these ribs are connected by hyaline cartilage, but inside the joint here we have small cavities. That's why they belong to synovial. This one doesn't have any cavity. So the cartilage is hyaline cartilage. That's why this is synchondrosis. Symphysis. You see, these cartilages are fibrocartilage. So these are intervertebral discs hold the vertebrae together, and these are symphysis type joint. Also this one, you see, pubic symphysis. This piece of cartilage where two hip bones are attached. This is also a fibrocartilage. That's why this is another symphysis type of joint. Yes. Oh, okay. So these are the intervertebral discs, right? Intervertebral discs. The vertebrae, the body of vertebrae are attached to each other by fibrocartilage. And in this skeleton, you can see that two types of cartilages are shown by two different colors. This is hyaline, you already know from the lab, and this is fibro. So fibrocartilage, if the bones are held by fibrocartilage, that is what? Symphysis. If the bones are held by hyaline cartilage, that is synchondrosis, right? So those are two types of cartilaginous joints. So here you see, I gave you the example of first rib attached to the sternum by hyaline cartilage. So this is an example of synchondrosis. Here you see intervertebral discs and pubic symphysis. Synovial, there are 7 different types of synovial joints, and most common type of joint in your skeleton is synovial. Couple of examples of synovial. Shoulder joint is a ball and socket type synovial joint. There are 7 types: ball and socket, hinge, saddle. Those are different types of synovial joints. Just know that most freely movable joints and most common type of joints are synovial. So 2 things: most freely movable and most common type of joints are synovial. Now, if you see a synovial joint, following structures must be present in the synovial joint. So these are the properties. These structures are present in a synovial joint. What are these structures? Articular cartilage. What is that? The end of the bones. For example, this is a joint. Look at me. This is a joint. So these 2 bones, this is one bone, this is another bone, meet here, and the end of the bones that form the joint are covered by hyaline cartilage, and that is called the articular cartilage. Okay, so that is one structure present in synovial. Joint cavity. You see here again, there is a space between these 2 bones, and that space is called the synovial cavity or joint cavity. So synovial cavity must be present, and that cavity contains a fluid that is called the synovial fluid. So there is a space or gap between the bones in the joint, and that is the synovial cavity, and that space or gap is filled by a fluid, and that fluid is called the synovial fluid. It's a lubricant type fluid. So that's why these type of joints are freely movable joints. Articular capsule or joint capsule. What is that? You see again, this is the synovial joint, right? Around the joint you have a connective tissue membrane. that covers like this. So these two are forming the joint, and around that you have a wrapping or covering of connective tissue membrane, that is the capsule. And then I have mentioned the cavity contains fluid, so synovial fluid must be present in that. So this is a typical synovial joint. You see this picture. I may ask you in your test, draw and label different structures of a synovial joint. So you have to draw them. Make sense? Okay. So let me quickly draw. Okay, so this is the end of upper bone. This is the end of lower bone. So first thing is, I said that ends are covered by hyaline cartilage, right? So this is the hyaline cartilage that is also called articular cartilage, right? Articular means joint. So joint cartilage, very simple. So the articular cartilage covers the end. Then this is the space that is called the synovial cavity. And this cavity contains a fluid that is called the synovial fluid. Okay.
That's why it's movable.
Yeah, because space gap is there, right? If they are strongly attached, they won't be able to move, right? Since there is a gap or space, you can easily move the bones. So you can say synovial fluid in synovial cavity. And then around the joint you have capsule like this. And this capsule has two layers, outer layer and inner layer. So double layered. Articular capsule or joint capsule has two layers. Okay. Outer layer is fibrous capsule and inner layer is synovial membrane. So you need to know those two layers of articular capsule. Now, inner layer synovial membrane is important because synovial fluid is secreted from the synovial membrane. So synovial membrane secretes the synovial fluid, this fluid. Okay, is secreted by that membrane. That's why called synovial membrane. Now, outer one is fibrous capsule, and this one provides protection. You know, any structure I mentioned before is fibrous. Lot of fibers are present, that is very tough. Since outer layer is fibrous, that is tough, and that provides protection, and inner layer secretes fluid. I mentioned many times, same thing, right? Repeating, so you won't forget. Now, in some large synovial joints, not in all, in large synovial joints, we see another structure that is called bursa. Why we did not include bursa when we talked about the structure of a synovial joint? Because bursa are not present in all synovial joints, present in large synovial joints. Bursa are flattened sacs filled with fluid, synovial fluid. So fluid filled flattened sacs are bursa. So like this, filled with fluid. Okay. Flat sac filled with fluid. And what happens, bursa prevents the friction when the bones move at the joints. The bursa, presence of bursa reduces the friction because they work like ball bearings. In bicycle or car, we use ball bearing. They roll. So what happens, you see, if this is the joint and this is the bursa, now when I move the bones, the bursa roll, right? It rolls. And it's like, ball filled with water, right? So we'll roll like this and reduces the friction. Number 2, increases the mobility, movement. So the movement gets faster. So those are 2 important functions of bursa. Bursa are present in large synovial joints, for example, in shoulder joint. Let me give you an example. It's a good example. This is the acromion of the scapula, you know that already. Under that, there is a big bursa that is called subacromial bursa. Makes sense because sub means under, the acromion of the scapula, right? So this is the bursa here, that is called what? Subacromial bursa. Now to remember this name, what you have to know? You have to know the name of this structure. That will make it easy, right? So if you don't remember the past things, you will have difficulty in following. If you don't remember what is this, then you have problem. But if you know already, this is acromion, so subacromial bursa is here. And now you see, when you move the humerus, head of the humerus is moving, right? So this bursa will roll like this and will prevent the friction and increase the movement, amount of movement. You see here that green structure is a subacromial bursa. And movement. So why skeleton has the joints? Skeleton has the joints to help the movement of your body parts. We know that we move our body parts at the joints with the help of the muscles. Now I have added that with the help of the muscles. Without muscles, your joints are useless, right? Because we move the bones or body parts at the joints by the muscles. Muscles provide force or power. Now, most of the muscles of your body cross the joints. For example, the muscle arises here, cross the shoulder joint, and other end gets attached to the next bone. So this is a muscle arising here and ending here. Okay, starting here, ending here. Most of the muscles cross the joints like this. Arm muscles cross the elbow joint and get attached to the forearm bones. Forearm muscles, you see here, cross the wrist joint and get attached to the hand. Make sense? Hand muscles cross the finger joints and get attached to the finger bones. So that's how the muscles are attached. They cross the joint and get attached to the next bone. Now, there are two ends of a muscle, origin and insertion. Origin is the end attached to the fixed bone, and insertion is the other end that is attached to the bone that moves. Now let me give you an example. See here, look at me. A muscle that starts in the arm, I mentioned, crosses the elbow joint and gets attached to the forearm. Now this is the muscle. So when I move my forearm, you see my arm is fixed. Who is moving? The forearm. Make sense? This is fixed, this is movable. So this end is the origin because it is attached to the fixed bone, and this end is insertion because attached to the bone which is moving. So that's how we determine the origin and insertion. And when we contract the muscle, you see here again, origin is fixed. What happens? The insertion, this end comes close to the origin. So insertion moves towards the origin. Now movement can occur in different planes. Most common planes of movement are transverse, frontal and sagittal planes. Now let me give you an example, you will understand. These are the common planes. So sagittal, you remember this is the sagittal suture or sagittal plane, you must remember this is sagittal plane, right? So if I move my body in same direction, that is the sagittal plane movement. Is it clear? Okay. This is what? Frontal, right? You remember frontal plane? So if I move my body this way, that's the frontal plane movement. Clear? Now transverse, this way, right? This is transverse or horizontal plane, you already know that. Now example, if I move my head sideways like this, you see? Make sense? Or upper part of the body. Lower part is fixed, upper part I am moving like this. Clear? So if I move my head only, see here, this is what? Which plane? Sagittal. Very good. If I move my head this way, frontal. If I move my head this way, transverse. Is it clear? So those are three main planes of movement. Sometimes we combine two or more to make the movement more complex. Okay. Now, name of different movements in the joints. Gliding. Gliding movement occurs in flat surfaces of the bones. For example, you have two bones, you see here, this end is flat, this end is flat, so the joint is like this, and what kind of movement is possible here? Like this, sliding, like this. So that is gliding type movement. That happens in between carpal bones, intercarpal joints. You know, cubical shaped bones, these are carpal bones. So what happens, this is one carpal bone, this is another carpal bone, flat surfaces, little movement, not too much, occurs like this. The two flat surfaces are there. Angular movement. There are different types of angular movements where the size of the angle changes. So this is one bone, this is another bone, the size of the angle changes. Make sense? Does it make sense, everybody? Size changes. So for example, you see here, you will understand, this is like 180 degree, right? Here. Now if I flex my forearm, the size is getting smaller or bigger here? Smaller, right? It is now greater. Smaller, right? Now look at my shoulder. Look at this angle here. Getting bigger, right? Getting smaller. Make sense? So the angle, the size of the angle changes. That's why called angular movement. Now there are different types of angular movements: flexion, extension, hyperextension, abduction, adduction, and circumduction. Let me give you the example of each. Okay. So this is elbow joint, and this is the flexion of your forearm. Flexion of forearm at the elbow joint. Now in flexion, you will now tell me this size is getting what? Smaller. Is it clear? So in flexion, the angle gets smaller, bones come close to each other. Makes sense? These two bones are coming close to each other. Opposite of flexion is extension. So very simple. Now if I put back, you see, go back, the size is getting bigger, right? So that is extension. This is flexion, this is extension. Now hyperextension. In this joint, you see again, this is what? Flexion. This is what? Extension. This is fully extended, right? I cannot go beyond that. Fully extended. So hyperextension is not possible in this joint. Now, in some joints, you can do hyperextension. Let me give you an example. So now look at this angle here. I am moving my head forward. So this angle is getting what? Smaller, right? So this is flexion of my head. Is it clear? Now going back. This is extension of my head. Is it clear? And this is normal anatomical position. Now if I want to move further back, I can do that more. Going beyond extension, that is hyperextension. Is it clear? So in some joints, hyperextension can occur, but not in all. Again, let me give you another example. Now look at the upper part of my body and see this angle getting smaller, right? So this is flexion of the upper part of the body, right? This is extension of upper part of body. Make sense? Now this is what? Hyperextension. So those are three.
So it's basically like from the normal anatomical position. Like if it's
Go farther.
if you could
Yes.
keep going further back
Yes.
from
Yes. Abduction, adduction. Now you see my shoulder joint, this angle. If I move sideways, my arm is going away from my body, midline of my body. So this is called abduction. This angle changes and you move laterally and medially. This is abduction and this is adduction. Okay? So bringing close to the body, that is adduction, taking away, abduction from your body or midline of the body. Now you tell me, look at my thigh. This is what? Abduction, right? This is adduction. Abduction, adduction. Make sense? Okay.
So if you like cross your legs over, would that be like hyper?
There is no term we say hyper adduction. We don't use that. Right?
Okay.
Yeah. Now, you have heard the term, right? Abducted. Person has been abducted. That means taken away, right? So moving away. So abduction, adduction. Circumduction is circular movement. Now you see, I am moving my upper limb like a circle. To draw a circle, you move like this, and that is circumduction. So if you draw a circle, the movement occurs here, that is circumduction. You know, in baseball, you throw the ball like this, right? But there is another game, I don't know if you have heard, probably you have heard, you must throw the ball like this. That is what? Cricket. Yeah, cricket. So cricket, you can fold. You have to do circumduction. Okay. So if I ask you to draw, now you can draw a small circle or big circle. You see, if I draw like this, that is circumduction. If I draw like this, that's also circumduction. Okay. Rotation is a little bit different than circumduction. You see here, if this is the bone and I am moving like this, that is what I have already mentioned, circle, circumduction, right? Circumduction. Now rotation is this. The axis is not changing. If I put something through this, will not change. You see here? This is what? Rotation. So moving around the axis without changing the axis. Axis is fixed, you see here. So this is rotation. Now if I move like this, draw circle, that is circumduction. Makes sense? So now you tell me, if I move my head like this is what? Circumduction. Now if I move like this, rotation, because not changing. Make sense? So if I pass something through my head, it will not change, like it will stay there. I will move around it. So rotation, circumduction. Now special movements: supination, pronation. Supination, supine. Yes, no, that is supine. Yes. So if I lie down on the bed like this, that is supine. Okay. So now if I turn, sometimes we do turn my upper part of the body towards the bed, this part will go towards the bed, that is pronation. So here the best example is your palm. You see, this is supine, right? So now if I move my palm downwards towards the ground, that movement is called pronation. Now going back to supine position, that is supination. Where we are ending, that's the movement, okay? So now, you see, where I am ending, this is supine, right? So that is supination. Now, opposite is pronation. Supination, pronation. Is it clear? Now in pronation, you see what happens. When your forearm is in supine position, the radius and ulna are parallel like this. Now when I move my palm towards the ground, what happens? This end of radius crosses. You see here, this end is fixed, this end is going to the other side. So what is happening? Like this. Crossover takes place in pronation. Dorsiflexion, plantar flexion of foot. This surface you need to know. This surface of foot, upper surface, if this is your foot, this is the upper surface. This surface is called the dorsal surface, and plantar is the sole, right? Plantar surface is what? Sole. So this surface, yeah. So plantar is the sole and dorsal is the upper surface of the foot. Is it clear? So now if I move my foot, you see, up like this, that is called dorsiflexion. This part towards the dorsal surface, dorsiflexion. Is it clear? Towards the plantar surface, now like this, that is plantar flexion. So dorsiflexion, this is dorsal surface, so dorsiflexion, this is plantar flexion. Inversion, eversion. If you move your foot inwards like this, that is inversion. Outwards, eversion. So you see here, look at me. If I move my so tell me, if I stand on my heel like this, if I stand on my heel, that is what? Dorsiflexion, right? If I stand on my toes, plantar flexion. Make sense? Protraction, retraction. Pushing outwards is protraction. Bringing inwards is retraction. You know, you use the term, sometime we use the term, see in the newspaper, that we have retracted our soldiers. Did you read anywhere? Retracted, right? Our soldiers from the battlefield. That means what? Pulled back, bringing back. Make sense? Retraction. And protraction is opposite. Now you see, if I push my mandible, this is the mandible, you know, forward, that is what? Protraction, right? Protruded mandible. Have you heard that term? Protruded mandible. Some people have, like, this part is kind of a little bit forward, right? It's a protruded mandible. So protraction. Now if I move my mandible backwards, that is retraction. Okay. Elevation, depression. Good example. When you open the mouth, the mandible moves downwards, right? That is depression. When you close your mouth, mandible moves upwards. So that is elevation. So moving down, depression, moving up, elevation. You know, elevators move you up. So those are different types of movements occur in the joints. Now here you see, I will quickly go, I gave you these examples for a long time. Gliding, if two flat surfaces, for example, two carpal bones move like this, that is gliding. This is flexion of the head, extension of the head, hyperextension, flexion of the upper part of the body, extension, hyperextension. I gave you these examples. Abduction, adduction, circumduction, rotation. Now, rotation, you see here, when I move my head like this is rotation, right? Now, if I move this way, that is lateral rotation. This is medial rotation. Make sense? Lateral rotation, medial rotation. You see here in pronation, what happens? The radius crosses over the ulna. So the movement is where you are ending. You see in this picture, supination, when you take your hand in supine position, that is supination. This is pronation. Dorsiflexion, plantar flexion, inversion, eversion, protraction, retraction, elevation, depression of mandible. Okay, so those are different types of movements. Now, we'll just talk about a couple of large joints and see what structures are present. So you'll get some idea inside the large joints, what are the structures you're supposed to see. Largest synovial joints are knee joint, elbow joint, shoulder joint, hip joint. Among these, knee joint is the largest and most complex joint in your body. Largest and most complex joint in your body is the knee joint. You know, all these are synovial joints and plenty of movement occurs in these joints. Now, why knee joint is a complex joint? Because you already know that in the knee joint you have actually a number of joints. Within the knee joint you have 3 joints. Those 3 joints together form the knee joint. Which 3 joints? You know, the lower end, you see the lower end of femur has 2 condyles, right? These are the condyles, and upper end of tibia also has 2 condyles. So these 2 condyles articulate with these 2 condyles. So these are 2 separate joints between femur and tibia. And another joint is the patella, articulates with the patellar surface at the lower end of the femur. So this is another joint. So those 3 joints are within the knee joint. Lateral and medial tibio-femoral joint between tibia and femur. Lateral, medial, lateral, medial. And another is the another is the femoral-patellar joint between the patella and femur. So this is a knee joint. And if you see, first let's see around the joint. You already know in the synovial joint, around the joint you have articular capsule, right? Remember that? Connective tissue membrane that wraps the joint. So you have articular capsule. Also, another important property is articular cartilage. Hyaline cartilage covers the end of the bones, that I have also mentioned. So you see the blue structures covering the bones. Those are articular cartilages, hyaline cartilage. Then you have synovial cavity, the space between two bones, and that space contains synovial fluid. So definitely those are the parts of a synovial joint. Now, since this is a large synovial joint, you have those flattened fluid filled sacs called what? Anybody? That roll, bursa, right? So since this is a large synovial joint, you have a number of bursa here. Those green structures. So which bursa are present around the knee joint? Let's see from the top. You see that large one above the patella, that is called suprapatellar bursa. Makes sense? The name supra means what? Above the patella. That's why it is called suprapatellar bursa. Below the patella, you see infrapatellar. If you see below, infrapatellar bursa. So suprapatellar is above, infrapatellar is below. Now, just in front of the patella, that means under the skin, right? Because you have the skin, then the patella, right? Here. So, under the skin, but before the patella, you have another bursa, that is the subcutaneous prepatellar bursa. Make sense? Sub means under, cutaneous means what? Skin. So, under the skin, before you hit the patella, right? That's a prepatellar. If I go this way, under the skin, but before the patella. So all these make sense, the names. Subcutaneous prepatellar bursa. Now, inside the joint, you have cruciate ligaments. Okay, so anterior and posterior cruciate ligaments are present inside the joint. And another thing you need to know is inside the joint, you see in the deeper part of the inner part of the joint, you have fibrocartilaginous meniscus. You see the deep blue color, that is the meniscus. You know, in the knee joint you have meniscuses. I believe many of you know. So meniscuses are fibrocartilage, and around that you have articular cartilage, which is hyaline cartilage. You already know articular cartilage is a hyaline cartilage present in all synovial joints, right? But in knee joint you have also fibrocartilaginous meniscus in the inner part. Okay, and outer part has the hyaline cartilage. Sometimes torning of meniscus occurs, right? Torning of cruciate ligament and torning of meniscus, commonly heard. Now, around the knee joint, you have a number of ligaments. Cruciate ligaments are inside, right? You see here, inside the joint, anterior posterior cruciates. But outside of the joint, you have a number of ligaments. Above the patella, you see here tendon of quadriceps femoris. Why it is called a tendon? Because if you see, the structure connects a muscle to a bone, that is called a tendon. So this structure is connecting the quadriceps muscles to the patella. That's why it is called quadriceps tendon. Now, exactly similar structure below the patella, it is connecting patella to the tibia. That's why this is called patellar ligament, not tendon. Why? Because bone to bone. Okay. So if you see, the structure is connecting bone to bone, one bone to another, that is a ligament. But structurally, they are same, connective tissue. dense, regular type connective tissue. In both sides of patella, you have retinaculum. Again, same structure, but if you see that structure is flat like a membrane, that is termed as retinaculum. Instead of ligament, we say retinaculum. If it is rope-like, that is ligament. If it is flat, like a sheet, that is retinaculum. But structurally, they are same. So, lateral patellar and medial patellar retinaculum. And then you have collateral ligament. Now in tibial side, tibial collateral, in fibular side, fibular collateral. So it's easy. You see fibular collateral attached to the fibula, tibial collateral is attached to the tibia. So medial one is tibial, lateral one is fibular, because we know that in the leg, medial bone is the tibia, lateral bone is the fibula. So tibial collateral, fibular collateral. So those are the ligaments or retinaculum around the knee joint. Okay. Now patellar ligament is very often used to test the knee joint, right? Are called knee reflex or patellar reflex. Same thing, knee joint, knee reflex or patellar reflex. We use a small hammer, right, to tap on that ligament and see if the leg kicks forward. If it does, that means the reflex is present, to test the nervous system. Okay. As I have already mentioned, torning of cruciate ligament or torning of meniscus happen. Shoulder joint, another large synovial joint. This joint is a ball and socket type synovial. Why? Because you see here, you already know, shoulder joint is formed by the head of the humerus and glenoid cavity of the scapula. Glenoid cavity is the socket and head is the ball, right? So ball and socket, right? Makes sense? So ball is the head of the humerus and socket is the glenoid cavity, like this. Now, there are ligaments around this joint. Those ligaments are easy to remember the names if you know the parts of the bones. Coracohumeral, you already know, I'm sure. This is the coracoid process of the scapula, like beak of the bird I mentioned. So this is coracoid process, and this is humerus, upper end of the humerus. So you see here the ligament is like this, from the coracoid to the humerus. Coracohumeral ligament. Make sense? Coracohumeral. Then coracoacromial. You know this is coracoid again. This is acromial. So coracoacromial ligament is like this. Coracoid and acromial. So coracohumeral, this one. Coracoacromial, this one. Then glenohumeral. There are three. You know this is the glenoid cavity. So glenohumeral, from around the glenoid cavity goes to the humerus. That's why called glenohumeral. There are three. So those are the ligaments, and very easy to remember the name: coracoid to acromion, coracoacromial, coracoid to humerus, coracohumeral, glenoid to the humerus, glenohumeral. Now, I have already mentioned a large bursa is located here, that is called subacromial bursa. Here. and this helps a lot in the movement of the shoulder. Okay. These are the ligaments that I have mentioned. So you can see those ligaments. There is another bursa that is called subscapular bursa. It's under the scapula. Subscapular bursa is here. This is the scapula. This is under the scapula. So subscapular bursa. Subacromial, subscapular bursa. So, a clinical condition I'm sure you have heard that is called bursitis. Have you heard this? No? Bursitis, itis is inflammation. Itis, if you see that term, itis, that means what? Inflammation. And there are hundreds of itis, right? If you start from here, meningitis, conjunctivitis, right? Rhinitis, nose, pharyngitis, laryngitis, tonsillitis, right? Nephritis, hepatitis. So there are hundreds, itis. So itis is inflammation, bursitis, inflammation of the bursa, right? Inflammation of the bursa. Bursa rolls like this, right? But when inflammation occurs, that becomes restricted. The movement is restricted, right? And painful because inflammation is there. So when you try to move, pain. And the movement is also restricted. So that happens. Sometimes what can happen if something hits very strongly, that can, crash the bursa. Fluid can come out, right? Will be very painful movement if it bursts. Yes.